Good morning, everyone, and welcome to our 4th annual Missouri Immunization Conference. It's great to see everybody in person again for the 2nd year in a row, so yay! We actually sold out for this conference, so that is fantastic. In total, between attendees and exhibitors, we have almost 300 people, so yay! So this year's conference theme is Building Immunity in Missouri Communities, which is very important throughout our state of Missouri as we all strive to increase our immunization rates. And so I'd like to quickly just start off with introducing the staff. Most of them are around working from the Missouri Immunization Coalition, but I am Nicole Cope. I am the Executive Director. We have Nicole Williams, the Assistant Executive Director. We have John Shelby, the Communications Director. We have Kaleche Onyaaka, a Public Health Educator. And we have Tessa Feeney, a Public Health Educator. So a big thank you to the entire staff for all the work they've done for this event. Next, I'd like to remind everybody about the networking dinners our Board of Directors will be hosting this evening. We have Dr. Annie Eisenbeis, who will be hosting a networking dinner at Shakespeare's Pizza downtown. For those of you that don't know, Columbia is widely known for Shakespeare's Pizza as being one of the best pizza places in all of Missouri. And then we also have Dr. Kate Lichtenberg, who will be hosting a networking dinner at Broadway Brewery downtown. Broadway Brewery often has live music at their venue as well. And so the signups are located at the registration check-in desks. They'll be there until 3:30 today. The networking dinners start at 5:30 tonight. So we hope to see all of you there with us, maybe meeting some new colleagues while you're here these next 2 days. And then throughout the conference, during the breaks, you notice our videos up on the screens. There'll also be a QR code, which is linked to a survey of the event. So please fill out that survey for us. It helps us learn how to better prepare a conference for you in the future. If you are requesting continuing education credits, after the conference, you'll receive an email with a link to complete that survey for your CEs. So please don't confuse the two. The QR code you'll see here is for the actual event to help us plan for the future. And if you're requesting continuing education credits, you'll get an email with a link to fill out your forms and get your continuing education credits that way. And during the general membership meeting today, there will also be a QR code for our final survey on the COVID-19 work we've done for the past 5 years. This is an evaluation summary of all the things we did during the pandemic. So we greatly appreciate your feedback on that as well. If you should need it, there is a hospitality room in room 124. If you go out towards the lobby and take a left, it's downstairs. So it's room 124. And I see lots of you wearing the t-shirts that you purchased last year. We have them for sale again. They are $25 and you can purchase one at the registration desk. The exhibitor passports that you all got in your folder. We encourage you to visit all of our exhibitors. Tomorrow, we will be doing 3 raffles. So once you complete and get your either an initial or a little dot on your exhibitor passport, you can put it in the basket at the Missouri Immunization Coalition table in the exhibit hall. And we'll do raffles tomorrow where we have Dr. Paul Offit's brand new book, which will be the raffle prizes. And so finally, please be respectful of each other during the conference. You know, some of the topics may be difficult to hear, and that's okay if you need to take a break, walk out of the room, come back at a later time. But please be respectful of your fellow workers here in the conference hall. And so without further ado, I'd like to introduce Ms. Lynelle Paro, Missouri Bureau Chief of the Bureau of Immunizations. Lynelle is the Bureau Chief for the Missouri Department of Health and Senior Services, Bureau of Immunizations. She also currently serves as the coordinator of the school daycare and immunization programs. Ms. Paro's been with the department for 28 years. And so to kick off our conference, let's give a big welcome to the Bureau Chief of the Bureau of Immunizations.
Good morning. I also want to give a big call out to the planning committee for this conference. They put a good conference together every year. You can tell by the turnout, we've got a lot of great turnout. And I especially want to have a call out for Nicole Williams for being so patient with me in my last minute of getting everything to her every time she asked for something. So she was very patient with me, and I greatly appreciate that. So we have a lot of great topics that are going to be presented over the next 2 days, a lot of great presenters. And I think this will help set the stage for us to start discussions, develop planning on how we're going to bring our immunization rates in Missouri up. I know that everyone has had the last 5 years have been rough. We all know that immunization rates are down, that immunization uptake is down, and we want to build that back up. So I'm going to start out with, and I have to give a disclaimer of, I'm not a data person. That's why we have the data modernization group. They put all this together for me. I can't speak data-wise, but it's great visuals for us to look at. So each year, the schools in the state of Missouri, which is comprised of about 1,100 schools, are required to report K through 12 data to us for the immunization status of all the children enrolled in their school, enrolled and attending. We're going to look at kindergarten and 8th grade data over the last 5 years to see how it has decreased. So looking at the screen here, we have, this is kindergarten data across the last 5 years, and it's by vaccine antigen, or the required for kindergarten entry. And you can see by looking at the data that there was a pretty significant decrease from that 1920, or the 2021 school year, which is right around the time that everything hit with COVID. So we expected a decrease because places were closed. We weren't vaccinating because we were all closed and focused on COVID. But unfortunately, those rates continued to decline each school year. So the last school year that's depicted on not the very last row, but the second to the last row, is still preliminary data from the 23-24 school year, which we're still collecting. But you can still see that even yet this year, our immunization rates have declined in that kindergarten entry. Some of that is due to keeping in mind this is a picture that we get on October 15th, okay, or around about October 15th when the schools are required to report. So it's a snapshot in time. They're still focusing on getting kiddos that are what we call non-compliant because they don't have all the doses they need to enter school. They are still working on getting those records. But this is a pretty good picture because it stays consistent around that same time every year. You also have to take into account religious exemptions. So this screen does not show the exemption rate, but our current, as of last school year, the ending of last school year, we had gone from the school year prior was 2.7, and for the 22-23 school year, we had jumped to 3.5 in religious exemptions. That's a pretty significant increase. So that is not shown on the screen. What you're seeing here are the fully immunized children who still could be in that status of noncompliance or in progress or have a medical or religious exemption on file. This is 8th grade, and we look at kindergarten and 8th grade because that's where the immunizations coming in is kindergarten, and then there's no new requirements until they get into 8th grade when that meningococcal and Tdap is required. But you'll notice Oddly enough, that the meningococcal and Tdap has slightly increased, but we still have had a decrease in the overall, for the last 5 years, of the total average of immunizations for all kiddos in 8th grade, again, fully immunized. So now I want to talk a little bit about measles, because that's something we're hearing about every day. So as of April 19th, there was currently 125 cases statewide, or nationwide, and that being in 18 jurisdictions. And the reason I want to point out measles is because we have fallen as a state in our kindergarten rates below what we call the herd immunity. So to have good herd immunity to protect even those that can't get vaccinated, we want to be at that 95%. And you can see that we're well below that. The yellow circle shows that's your 2016-2017 school year data, looking at the preliminary data of this school year that we're just ending. So you can see there has been a significant decrease, which puts us in a very vulnerable position of that measles affecting all of our young kiddos. And again, this is kindergarten, only kindergarten. So this map, and these presentations you'll have, so the maps will be a little easier to look at, but this map shows the rate from the 2016-17 to now as far as the decrease or the difference between that county's rate. You can see the ones that are dark blue, those are the worst. Those have gone way down as far as what their immunization, fully vaccinated immunization rate is for those kindergartners. In kindergarten, we consider 2 doses as fully vaccinated. Oops, sorry, wrong way there. So this map shows, this is K through 12, so all data compiled together. And you can see the counties that are orange are at that 95 or above threshold, or that herd immunity threshold. Those counties that are in blue are below that threshold. So you can see by looking at this data that we have some areas of the state that are significantly below that threshold, which leaves them very, very vulnerable for outbreaks in that area. This is just kindergarten. So all of those blue counties are under that 95% threshold for all kindergartens, kiddos being fully vaccinated. To me, this is a very scary visual of how vulnerable Missouri is to an outbreak. And we all know that saying of, it's only a plane ride away. So one thing that we've done is we've done some measles outreach. We've pulled together, there's a site on our website, which you will have in the slide. You can click on the link. But for each county in Missouri, we have developed these fact sheets. And this is just a snippet of the top portion. But the link will take you to the website where you can select your county. And when you select your county, you'll be able to see the kindergarten vaccination rate, which is the statewide. Then we have the kindergarten vaccination rate that is for that county, and then what we have the exemption rate at for that county. And I did not choose Boone to pick on Boone, by no means at all. I just did Boone because that's where we're at. So this is something that you can use to share with parents. This is out on the DHSS website. It's public. There's a lot of different social media clips that you can get to look at, to use, that are not, branded as the Missouri Department of Health and Senior Services. And there's one for every county. This is the link. The very top one will take you to those fact sheets, and there's a big state of Missouri on there where you can, again, click the county, or you can select it from the drop-down menu. And then there's the links to the other resources, the social media images, There's some news releases that we've put out. There's going to be some state-level historical exemption data, and then some provider advisories that we have put out. And then there's also some other resources from CDC that link directly to CDC as far as, measles, things you can share with your patients and such. And I know that was very fast, but do you have any questions? I'm not seeing any questions. And again, I thank you all for coming, and I'm excited to hear some of the great speakers and how we can move Missouri back up to that herd immunity for the entire state.
Coming over to you with a question.
Hello. Just real quick, is MMR the only vaccination rate that's up there in a fact sheet, or do you have other tools and other vaccinations that we're looking up? I know your original had the DTaP, it had varicella. Is there one fact sheets for those immunizations as well?
Not currently. We are working on developing different fact sheets as well as a dashboard where you can look at specific county level. Right now, we don't have our school data that's public facing, and we're looking at developing a dashboard or that you can go to, select your county, and see the rates for all different vaccinations. We just started out with MMR because that's a topic that's pretty heavy right now.
Any other questions? I see you, Marge. Weaving my way through.
Lynelle, you know that I'm Marge Cole and I'm the state school nurse consultant. I'm here because I don't know everybody else in this room. And because I'm a school nurse and I work with all school nurses, we're very alarmed about keeping all kids safe. And if you have, in your county, you have anything that I can do to help you help our school nurses get our children vaccinated, please see me during the conference. I'm here only because I want to make sure that I can connect our school nurses with the wonderful resources we have.
Thank you.
Anyone else have a question for Lynelle? Going once. Gotcha. Lynelle to Lynelle.
Lynelle to Lynelle.
Hey, sister.
Hey.
Lynelle Phillips here. I had a question about the change in the law regarding exemptions, whereas I think prior to January 1st, you had to have an appointment at the health department, and now you can just download the exemption form off the website. Do you think that is having any impact on the exemption rate?
Lynelle. That change happened in December. I will be right forth honest with everyone in this room. I fought that tooth and nail. I can't say for certain, but I do have a feeling that it does have something to do with it because of the fact that it is so easy now to just go out, print that exemption, and put it on file. Doesn't have to be that original card as we had before. I know not every health department had the same policy where you had to make an appointment, but at least you had to go somewhere and pick up that card and take it to the school. And now you can just, and that's not just for religious, that's for religious, medical, and the in progress card. So they're out there for everyone. I honestly do feel that it has had an impact, but I don't know that we really have a true way to measure it because our exemption rates have been climbing. Our religious exemption rates over the last 3-4 years have drastically gone up each year. I have not finalized the data from this year, But just looking at the preliminary data without going in and calculating, this year I think we're going to end up probably close to 3.7, 3.9, if not 4%. And it is an issue, but unfortunately it was something that was out of the department's control. And unfortunately, I honestly don't feel that there's ever any taking that back.
We have another question over here, Lynelle. So just curious, who made that decision? I want to know.
Well, it was a decision that was made because we had a lot of constituents going to the governor's office, going to their representatives, complaining about how hard it was to get that religious exemption. I don't know that it was that hard. People feeling that we were infringing on their rights, making them watch videos, read literature, and it was a decision that was made at a higher level than the department, and we just needed to follow that decision.
Other questions for Lynelle?
All right, thank you, Lynelle, for such a great presentation.
Thank you, thank you.